We often hear about gaps and disparities in access to health care, but those problems are even more pronounced when it comes to dental care. One response to that is in the efforts of the DentaQuest Partnership for Oral Health Advancement. To tell us about its recent grants to agencies in Boston is our guest from DentaQuest, the president of the DentaQuest Partnership, Alison Corcoran. Thank you very much for being with us, Alison.
Thank you. I'm delighted to be here.
I want to start with the gaps, even if you're talking about the big picture here. What's it like? I mean, how many people are missing out on dental care?
Well, really millions of Americans are missing out on dental care. We have pretty good dental coverage for children, but only 18 states have dental coverage for adults through the Medicaid program. And a nasty surprise for many seniors when they graduate to Medicare is there is no coverage of oral health in our current Medicare system.
And what about Medicaid? When people have that, how limited is the coverage?
The coverage really varies by state, and as part of the Accountable Care Act, there's very good coverage for children, but often for adults it's simply sort of emergency surgery or emergency visits, or in some cases there's no coverage at all. But there are other issues besides coverage that limit access to care. We see for many folks, there's sort of a series of what you might call locked doors that make it difficult to access care. So if you are a recent American and you don't speak English, getting access to care through somebody who speaks your language or in a culturally appropriate manner sometimes is an issue. There are areas across the country where there simply are not enough dentists to fulfill the need of folks who require care. There's also issues that are around access relative to how do you get to, literally get to the dentist. So we see really distinct and disturbing injustices in terms of what care looks like by gender, by race, by ethnicity, and by...
Unpack that a little bit. What about those racial disparities?
So what we see is in areas where there is lack of access to care, typically are in areas that are a higher percentage of African Americans. It's also a particularly difficult issue for Native Americans and Native Alaskans as well.
I also sort of figure about half the people in America at least 30 years old have periodontal disease or gum disease, I guess?
Yes, gum. There are two major diseases of the teeth and mouth, and the third is oral cancer. The first is caries or cavities, or teeth decay, and the second is periodontal disease. I think it's a little bit older than 30 in terms of folks who have periodontal disease, but it is a real scourge and something that is tied not only to poor oral health, but also to poor overall health with strong correlations with diabetes and heart disease, among others.
Well, one thing about at least some of those diseases is that treating them is pretty expensive, isn't it?
Well, periodontal disease is treatable. It's basically an inflammation, and there are a variety of ways to treat it. Regular preventive visits, which are not very expensive, is one of the most effective ways to address it.
Explain the prevention strategy, because that's central to what you do, right?
Yeah, so at DentaQuest, we really think of ourselves as a oral health company that's trying to change the oral health care system from the inside out. And we're doing it through our all-in approach, which we call preventistry, clever use of prevention and dentistry. And there are really four tenets to that. The first is care. We need to change how people think about care, how they no longer, not just as a visit to their dentist, but also taking care beyond the chair and into the community. There's also a real need to change how dentistry is paid for. So right now we are primarily in a fee-for-service situation where dentists bill for the procedures that they are doing with their patients. If we can move to a value-based care approach, as much of total health has already moved, we'll get better results at a lower cost per person, meaning more people can have access to care with healthier mouths. The third piece is really around innovation and thinking about oral care in a different way, thinking about how you could do telemedicine, for instance, how you can use salivary diagnostics, how we can think about other creative ways to encourage good oral behavior, good oral health behavior. And then really the fourth aspect of preventistry is what we call transformation. And it's beginning to think about what can we do, not just with oral care, but for the system overall, to make it easier to access care, to open those doors that might be locked, and to address some of the issues that are not what you would normally think of as exclusively an oral health issue, like opioid addiction, like food insecurity, other social determinants of health. We think those are all related.
This has been the news. We're talking with Alison Corcoran from DentaQuest. Alison, what about the organizations you're funding in Boston? Can you tell us a little bit about what you want them to do or hope they'll do?
Sure. So we are a Massachusetts-based organization, DentaQuest. Many people haven't heard of us, although we are working on that. And over the last 5 years, we have invested over $7 million with like-minded not-for-profits, helping us think about how do we change this system so that it does provide better access and better care for the residents of Massachusetts. And as a Commonwealth, we're actually better than most states. We have an adult benefit, and we have a periodontal benefit, which many states don't have. But we still have opportunities to improve.
What about some of the systematic barriers that people are faced with? Give me an example of that in Massachusetts, maybe.
Sure. So there are areas in the state where it is more difficult to find dentists. We do have a lot of dentists in Massachusetts, but out in western Massachusetts and in Cape Cod, for instance, there are probably more people who need oral health care than there are providers available to help with that. So that is definitely an area for us. The other issues that prohibit people from addressing their own oral care are also prevalent in Massachusetts. Those are things like, how do I get to the dentist? If I'm a working mom and dentists are only open during working hours, I can't take work off to take my kids. Those are issues. We have issues with language barriers and cultural barriers as well. The greatest opportunity we think that where Massachusetts can continue to push and lead is where we have done some recent grants, which is in the whole area of transforming care and thinking about it from the provider basis first. So we've given grants over the past couple of years to the Harvard School of Dental Medicine as well as Boston University, which are really targeted at dental students as well as medical students to get them thinking about how do we think about the mouth as part of the body. Sort of it's an accident of history that oral health and overall health are completely separate. And one of the ways to start changing that is while people are in their training and residency to give them exposure to oral health if they're a physician or physical health if they're a dentist.
Thank you very much for being with us.
You're very welcome.
Alison,
happy to be here.
Alison Corcoran from DentaQuest.